New York Governor Andrew Cuomo is finally receiving the attention he deserves for how he really dealt with the coronavirus pandemic during 2020. Throughout 2020, Governor Cuomo was praised for his handling of the coronavirus by members of the media. His name was even floated as one of the potential candidates for president at one point. He also received an Emmy Award for his masterful press conferences, and he even released a book in which he brags about how well he handled the pandemic. While most places were praising Governor Cuomo, there were a few individuals and other smaller online news sources covering how many people were killed due to the policies that he implemented during the early days of the pandemic. So now, after months of hard work and these people refusing to let Cuomo off the hook, they were relentless, the spotlight has finally exposed what Andrew Cuomo has done. So let's start back at the beginning. Around March 25th, 2020, we have the New York Department of Health putting out a nursing home mandate that requires all nursing homes to accept any patient that has been transferred from a hospital into their facilities. It states that no resident shall be denied readmission or admission to the nursing home solely based on confirmed or suspected diagnosis of COVID-19. Nursing homes are then prohibited from requiring a hospitalized resident who is determined medically stable to be tested for COVID-19 prior to admission or readmission. Now keep in mind that at this time, we know that the virus has a higher fatality rate in older populations, and it's not as fatal for people who are younger. Knowing this information, this is common knowledge, we learned it from, what was happening in Italy and places around the world. Andrew Cuomo still puts out a mandate that prevents nursing homes from rejecting these patients with COVID-19. You can even see a copy of the nursing home mandate. I'll put it here in the description to see exactly what's in it. Now fast forward to April 23rd. Cuomo goes on to say that nursing homes can't object to the state mandate. He says that if the nursing home cannot properly care for the patient, then they must transfer them to another facility. Basically, the patients would still end up in a nursing home somewhere. And if you don't believe me, you can watch this video right here of him saying just that.
Nursing homes, they are our top priority. They have been from day one. Remember how the nursing home system works. They are private facilities. They get paid to provide a service. They get regulated by the state government. There are certain rules and regulations that they must follow, and we put in additional rules and regulations on nursing homes in the midst of this crisis. Staff must have appropriate PPE. They must have their temperatures checked before they come into the facility. There are no visitors who are coming into the facility, which is a tremendous hardship, but it's necessary to protect public health. If they have a COVID positive person in the facility, that person has to be in quarantine. They have to have separate staff for the COVID residents versus the non-COVID residents. If they can't care for the person in the facility, they have to transfer the person to another facility. The nursing home is responsible for providing appropriate care. If they cannot provide that care, then they have to transfer the person to another facility. They have to notify residents and family members within 24 hours if any resident tests positive for COVID, or if any resident suffers a COVID-related death. That is a regulation that they have to follow. And they have to readmit COVID-positive residents, but only if they have the ability to provide the adequate level of care under Department of Health and CDC guidelines. If they do not have the ability to provide the appropriate level of care, then they have to transfer that patient. Or they call the Department of Health, and the Department of Health will transfer that patient, right? But that is how the relationship works. The state has very strict guidelines on privately run facilities. They get paid to take care of a resident. That resident, that patient must have a state-directed level of care. If they cannot provide that, they can't have the resident in their facility, period. Those are the rules. We're going to undertake an investigation of nursing homes now to make sure they're following the rules. It's going to be a joint Department of Health and Attorney General investigation. But those are the rules. They get paid to take care of a resident, and they have to do it in accordance with state rules. And if they don't, we will take appropriate action.
So on to May 10th, 2020. Now, Cuomo has started to come under a lot of pressure for his nursing home policy. So he releases an executive order that reverses this policy. The order states that patients may not be admitted into nursing homes unless they have a negative result from a COVID-19 test. So again, here in the description, I'll put a link to this executive order so you can see it all written out. You have proof, right? You don't have to take my word. You can look. And while all of this is happening, Cuomo continues to profess that New York is doing very well compared to other states when it comes to nursing home deaths. He brags about how New York is 34th in the country when it comes to the nursing. Keep in mind that New York only counts deaths as nursing home deaths if the patient died in the nursing home itself. They don't count patients who were transferred and died in a hospital, like all other states do. Cuomo ignores this particular difference and in the ways that states calculate the deaths, and he continues to brag that they are doing a better job than most other states. Here, you can go ahead and check out right now Andrew Cuomo's false claims on nursing home data. It says it all right here in different clips throughout the pandemic during his little press conference. Take a look.
If you look at the states and the percentages of people who died in nursing homes as a percentage of that death, New York is number 34. First of all, we're number 34 in terms of per capita deaths in nursing homes. You asked about nursing homes. You take 50 states, and you can put all 50. Where is New York? Number 34. You look how New York did on nursing homes vis-a-vis the nation. We did better than 33 states in the nation per capita on nursing homes. You look at us vis-a-vis the country, where we did better than 33 other states. Then those are just facts.
We're number 46 out of 50 states. And we had the worst problem. And we're 46th in terms of percentage of deaths in nursing homes.
So, with more attention being drawn to what happened with the nursing homes, the state legislature holds a hearing on August 3rd for the nursing home COVID death data. But Health Commissioner Howard Zucker refuses to hand over the information, claiming that the state was still auditing that information. At this point in time, Cuomo is still promoting the notion that the nursing home death count was low in New York. So then August 26th rolls around, and the DOJ requests the nursing home data for the investigation. Cuomo and his administration say that they need more time to prepare the data yet again. Then, October 28th, the DOJ announces that it's expanding its investigation even further into the Cuomo administration in New York because it was the only state not to count the deaths where patients were transferred from the nursing home to the hospitals. Finally, January 2021 rolls around, and the state finally updates its numbers, and on February 6th, the Department of Health website updates its numbers to the accurate count, including the ones from the hospitals. So, the New York Post conducted an interview or talked to one of Cuomo's aides, Melissa DeRosa, and she admits that the Cuomo administration froze when asked for the nursing home data. The following is her quotes on why they froze and why they didn't give up the data right away like they were supposed to. She says, right around the same time, then President Donald Trump turns this into a giant political football. He starts tweeting that we killed everyone in nursing homes. He starts going after Governor Murphy, starts going after Governor Gavin Newsom, starts going after Governor Gretchen Whitmer, and Trump directs the Department of Justice to do an investigation into us, and we basically froze because then we were in a position where we weren't sure if what we were going to give to the Department of Justice or what we give to you guys, what we start saying was going to be used against us while we weren't sure if there was going to be an investigation. So everything is now out on the table, okay? Cuomo's administration caused thousands of unnecessary deaths by placing COVID-19 patients into nursing homes. People lost countless loved ones due to this. When confronted with what they had done, they walked it back, changed the policy, and acted like their state was doing a superb job at handling the virus. Cuomo even received an Emmy award for his masterful COVID-19 briefings. Are you kidding me? That's usually for acting. He received an Emmy for his handling and his briefings that he did all the time. Meanwhile, he's lying during those about how well they're doing, and it's awful. The nursing home data was also conveniently withheld until after Cuomo's book on how great he was released. It's bad enough to enact a policy that everyone knew was harmful and would lead to the death of many, many people in the elderly population. But it's even more reprehensible to not own that mistake and try to cover it up. And I don't really know the best way to sum it up other than to simply show you this video on what Cuomo thinks of this whole situation.
Look, whether a person died in a hospital or died in a nursing home, it's the people died. People died. I was in a hospital, I got transferred to a nursing home, and my father died. My father was in a nursing home, got transferred to a hospital, and my father died. People died. By the way, the same people are dying today. 96% of the people who die are older people with comorbidities, which happens to be the population that lives in nursing homes. It's continuing today, even with all the testing that we're doing. If you look at New York State, we have a lower percentage of deaths in nursing homes than other states. A third of all deaths in this nation are from nursing homes. New York State, we're only about 28% only, but we're below the national average in number of deaths in nursing homes. But who cares? 33, 28, died in a hospital, died in a nursing home. They died. And I dealt with the loss of my father. The pain is so incredible and inexplicable, and why, it's a tragedy. It's a tragedy. And I understand maybe the instinct to blame or to find some relief for the pain that you're feeling. But it is a tragedy, and it's a tragedy that continues today.
That pretty much does it on catching you up with the news with Andrew Cuomo. And like I said in the last segment, I can't believe that Ted Cruz is receiving more coverage for his trip to Cancun than Andrew Cuomo is for the cover-up and all the crap they did with the COVID-19 response and the nursing home deaths. It's absolutely terrible, the way they're doing this coverage. But that's all for this video segment. If you're on YouTube, stay tuned. We'll be uploading another segment here in a bit on Facebook and Australia. What's going on there? If you're listening on audio podcasts, stay tuned. It'll be coming up in just a few seconds.